Welcome back to my video on understanding depression. Today we will look at the symptoms of depression, diagnosis and treatment. Symptoms. In this video we are going to look at the symptoms of depression. In the next video, diagnosis of depression and treatment of depression. Did you know that depression is a severely disabling condition that has a profound effect on all aspects of a sufferer's life? Depression is one of the most common of 4 psychiatric disorders. It is estimated that 5 to 10% of the population at any given time is suffering from unidentifiable depression. So what is depression by definition? Depression is viewed as an illness that is caused by changes in the neurotransmitters in the centers of the brain regulating emotions. What does this mean? There are neurotransmitters which are used to transmit, they are found in the brain, and they allow for the transmission of impulses from one nerve to another across a tiny gap called synapse. In depression, it is thought that there are little transmitters in the synapse. Many treatments aim to increase the levels of neurotransmitters in the synapse. Depression as an illness. Depression is an illness that can seriously impair all aspects of a person's life, including personal relationship, performance at work, and enjoyment of leisure activities. We are going to see this as when we are going to discuss on the symptoms of depression. Cognitive dysfunction is also a sign of depression. It is impaired concentration, impaired memory, and impaired decision making. It is a common feature of depression that can be easily identified in patients with depression, but may be overlooked and may persist once other symptoms are resolved. You know what? Symptoms of cognitive dysfunction are predictive of a poor outcome if they are not fully treated, and they are associated with marked effects on the patient's performance. At times, it is very hard to identify that maybe a group of people or a person in a group of people is suffering from depression. Why is it so? Let's see why. This is because one of the features of depression that makes it difficult to diagnose is that 2 people have the same symptoms associated with the illness. A number of symptoms are, however, commonly seen. What does this mean? For example, you have 2 people. Head call person A Tauran, person B Peter, person C, we call him Martin. Maybe Tauran is suffering from depression, and Martin too is suffering from depression, and even Peter too is suffering from depression. However, it is very hard to note that this who has depression and who has not depression, or if all of them have depression. Why is this so? It's because each of them will show different signs of depression. However, there are signs that are commonly seen in the patients who are suffering from depression. Let's see some of the symptoms of depression. 1. We have loss of interest and enjoyment in leisure activities. A person does not enjoy activities like he used to enjoy them. He loses interest in activities that may be used to make him sober, that used to cheer him up. Next, we look, it is a poor concentration and attention on task. This is impaired memory. You don't concentrate on the task given. You don't show attention. The next one is reduced confidence and self-esteem, and feelings of guilty and unworthiness. Moreover, we have bleak and pessimistic view of the future. They are not positive. They think that they should not live anymore because life has turned against them. There is this depressed mood. There is reduced energy, withdrawal, marked tiredness, or slight effort. you tend to notice that these people don't take a lot of meals. Actually, their appetite is affected. For this reason, they have reduced energy, and whenever they engage on a task, they show tiredness on slight efforts. The next thing, we'll see that they have ideas of self-destruction or suicide. Sometimes when they are alone, they think that life matters not to them. They think that life has ended for them, and therefore what comes to their mind is what we call suicide. They want to kill themselves, they want to hang themselves and die rather than live with depression. This is serious, and these guys need to be treated once depression is diagnosed in them. Another thing is low libido. This is commonly seen in couples whereby there's no interest for sex, there's no interest for there's not sexual desire which used to be. This is a cause of depression which need to be handled with and which need to be checked immediately it is recognized. Guys, there are more symptoms of depression. Other symptoms are diminished appetite. We say diminished appetite will cause a person to have diminished energy and reduced energy, and also to show physical weight loss. We have weight loss or weight gain, and sometimes we have unexplained symptoms. Thank you guys for watching this video. We are going to upload the video on diagnosis of depression and treatment. On the diagnosis part, we are going to have self-rating scale, how you can rate yourself and up until you are free from depression. Thank you for watching this video. Please subscribe to our channel for more. God bless you.